Assalamualaikum and good day. Welcome to the first module of Prescribing Skill Micro-Credential course. In this module, you will learn about what is prescription and its importance. Before we learn the prescribing technique, let's learn what is a prescription. So what is a prescription? A prescription is an instruction written by the medical practitioners that authorize the patient to be issued with a medicine or a treatment. RX is an abbreviation for prescription. A prescription is a legal written order from health professional to a patient, and it plays a significant steps in managing the disease of the patient. A prescription has a great influence in health and well-being of patient. Do you know that prescribing is the most important and frequent work as medical doctors throughout your career? Let's learn the role of a prescriber. A doctor who is also a prescriber decides the drug and the drug regimen. An ethical doctor would prescribe a drug based on the evidence-based practice and document the drug in the healthcare record of a patient. Next, a doctor who is also a prescriber would monitor the safety and efficacy of the prescribed drugs. In general, a doctor has legal responsibility of clinical care of the patient. Next, we are going to learn the importance of good prescribing skill. There are four main reasons why prescribing skill is important. The first one, it is to ensure that the patient receives the appropriate and optimum treatment. Secondly, it is to avoid prescribing medication that may be harmful or cause adverse drug reaction to treated patient, as it is preventable. The third one is to ensure the patient's safety and prevent morbidity and mortality, which can be associated with poor prescribing skill. And lastly, it is to prevent inappropriate prescribing to ensure effective and safer drugs are being used to the patient. Did you know that poor prescribing skills leads to prescribing errors in medical practice? Studies have shown that many medication errors occurred in hospitals and clinics are due to poor prescribing technique. Studies have shown that many freshly graduated medical doctors often make errors when writing prescription, particularly during their initial stage of clinical practice. However, do you know that prescribing errors also happen among senior medical doctors? This shows that error could occur as we are all human beings, and human error is the main factor in prescribing error. As medical practitioner, it is preventable, and our role is to minimize the possibility of making error in clinical practice. This can be achieved by providing adequate knowledge and skill in several areas in prescribing drug. One thing that I want you to know is that prescribing error is preventable. As I have mentioned before, human error is the main factor in prescribing error. However, as medical practitioner, it is preventable, and it is our role to minimize the possibility of making errors. These can be achieved by providing adequate knowledge, skills in several areas in prescribing step. Next, we're going to learn the general steps in using medication in clinical practice. The first step is called prescribing. In general, medical practitioner is responsible to choose the appropriate medication based on the patient's condition. The medical practitioner is expected to select the most appropriate route of administration, the dose, the time, the frequency, and the regimen. The second step in medication is called dispensing. The pharmacist will transcribe and check the prescription written by the medical practitioner. He or she will then pick the medication and make the documentation. The pharmacist will then ensure the medicine is being delivered to the correct patient. The third step in medication is called administering. This stage involves obtaining and ensuring the medicine is ready to be used by the patient. This stage requires counting, calculating, mixing, labeling, and preparing the drug in some way it is required. The administrators also needs to check for any allergy history from the patient. He or she also needs to check the correct dose, correct medicine, correct patient, correct time, and also correct route of administration. The fourth step in medication is called monitoring. At this step, the prescriber observes the patient's response towards the medication. The doctors needs to monitor positive response without causing any harm to the patient. He or she also needs to document any side effects or adverse drug reaction that occurs while the patient is on the prescribed medication. The doctor is also responsible to stop the medication once completed or stop the treatment if clearly shows that there is no improvement to the patient. Prescription writing is an important task that is performed by a doctor during patient management. Majority of medication errors occur as a result of poor prescribing. Hence, it is important to emphasize the need to improve prescribing skills among medical students, particularly during clinical years, and as well as freshly graduated medical doctors. In general, the process of prescribing a drug involves defining the patient's problem and diagnosis, specify the therapeutic objective, choose the treatment with proven efficacy and safety, provide information and instruction to patients, and prescribe the drug correctly, monitor the treatment outcome, and consider to stop when necessary. This micro-credential course on prescribing skill will take you step by step from problem to solution. The practice of rational treatment requires a logical approach, common sense, and practice systematically. After learning from this micro-credential course on prescribing skill module, you will understand the role of a prescriber and the important steps, which include many aspects such as specifying your therapeutic objective, choosing the appropriate drugs for the patient, informing the patient about the treatment, and monitoring the drug effectiveness.